It might not be the only topic people are talking about this election, but healthcare is a touchstone for many voters. We've heard from the candidates. Now we're joined by Dr. Doug Manuel. He is a primary care physician in Ottawa, senior scientist at the Ottawa Hospital Research Institute and at the Institute for Clinical Evaluative Sciences, where he was the lead author on a recent study about the cost benefits of health promotion and disease prevention. Dr. Manuel joins us now for his take on the party's promises. Good to have you here.
Good to be here.
Just give us a bit of background, first of all, on where you're at and what you're doing and all that kind of stuff.
Well, you started off describing me as a family doc, and I started that family doctor up north in Churchill, Norway House.
It's Manitoba.
Manitoba.
Okay.
And then I saw myself working there, loved it. But I saw myself. No, I think about it, kind of like a little microcosm of the healthcare.
How so?
How so? Like I'd be there for 30 years, and I'd be tighter and tighter, and everyone would be sicker and sicker. And I think working in those small communities, you really see, you see the whole community. And so I went back to public health and population health.
And what kind of medicine are you practicing now?
Well, I do some primary care with refugees, but mostly I'm a scientist at the Ottawa Hospital.
Why'd you make that turn?
Well, I felt that being a scientist, I can actually make the biggest impact. So public health and a scientist, I have the biggest reach and make the biggest impact.
Okay, so you have seen how our healthcare system operates and efforts at disease prevention and health promotion and all that kind of thing from a couple of different perches, which is why you're in that chair now, because we wanted to get your view on mostly what you just heard. You know what, I'm not even going to ask you a question. I'm just going to keep it very open-ended for you. You saw what the four parties have on offer. What'd you like?
Well, first, I'd like to congratulate you for starting a discussion with prevention. I've never seen that before in an election, so that was great. And I thought that they all really started to engage that. I was concerned that it was a little bit of sort of lip service to prevention, and then, like everything, we spend the rest of the time talking about waiting times. I didn't really hear a lot about their platform for prevention. What I did hear, which was encouraging, was a lot of the people were talking about prevention in terms of basic income pilot and housing. I thought that was fantastic.
Because that's a real thing, right?
Yeah, it's a real thing.
Solutions.
Yeah, I think as a research community, we're really excited about that the basic income pilot is happening. Because these are potentially sort of changing events in terms of how we understand what we can do at the community level for long-term health.
But there was a commitment from all of the parties, I think, to continue the basic income pilot and see what happens.
Yeah, I think that's very encouraging. Like that'd be a really encouraging sign for them.
Anything you heard, Dr. Manuel, that made you go, boy, is that ever a dumb idea?
Well, where I was discouraged, we put a lid on hospital care. 5 years later, where are we? If we put a lid on hospital care without doing anything really meaningful for the rest of the system, including prevention, the lid's going to boil over.
Just so I understand, when you say a lid on hospital care,
really the funding for the hospital has been pretty flat. And this has been going on in Canada for 50 years. Barrett Stoddard talked about this with doctors. He said, reduce the number. We have, Canada has more doctors than need. Reduce the number of doctors, but if you do that, you need other community services. And so we reduced the doctors and we didn't bring any other services. And I think that's the cycle that we're in, and that's the cycle that played out in the conversation that you just had.
But would it be your view that if you were in charge of the healthcare system, you would be spending a whole lot more on health prevention and a whole lot less on sickness treatment?
I think that you need to have the two tracks. You need to have the long-range strategic view of where we're going, and that's where you start. And I think that's how you started the conversation, which was great. Like when I walk through the hospital corridor, I just see all these patients. No one wants to be in a hospital. Most people don't need to be in a hospital if you started back 20 or 30 years. So when I walk through, I just
hang on, just so I get that. Meaning, if 20 or 30 years ago you started building capacity in the community
for prevention, when I walk through the hospital corridors, I see a lot of people that could have been prevented to not be there through healthy living. And I also see, for instance, people at end of life, that we have the highest rates of in-hospital death in developed countries. So I see a lot of people, and that's how we often will, when I talk with our hospital CI, we have that discussion. So many people want to be in hospital, but who are the ones that don't need to be there or don't want to be there. And so that's where I would have these two tracks and have that discussion. You know, in British Columbia, there isn't as big a conversation about waiting times. Where the conversation is, we're at Cabinet. You know, we interviewed folks for some of our previous reports, and the burning platform at Cabinet was the increasing cost of chronic disease and how every person on that Cabinet table had to address this in their ministry in some way. So it's a different discussion, plays out in different jurisdictions.
But in terms of politicians, I mean, we had a former health minister there. We had somebody who'd been the patient ombudsman for the province of Ontario. Had somebody who'd been the health critic for the NDP for 11 years. You got the leader of the Green Party who's got stuff to say about this. In terms of, I know medical people wish people who were in politics had a much better understanding of all the challenges and obstacles and so on. Did you get a confidence, or what was the level of confidence you had among that four in terms of them knowing where things are at?
I thought the discussion was good. I thought that they were all well informed of the healthcare system, especially.
In other words, if they were if any one of them were the decision maker, you'd be okay with that.
Well, I still am concerned about our cycle of try to control healthcare costs, no structural changes, boil over, keep on going, no long-range plan. We don't have health goals in Ontario. We don't have.
What do you mean we don't have health goals?
We don't have a goal of where we want to be in terms of life expectancy, smoking, obesity. We don't have a chronic disease prevention plan. When we did our diabetes strategy, almost all of it was for healthcare, with a small fraction for prevention, even though we know that it's just going to get worse if we don't do prevention. So.
But I want to make sure I understand you properly. Are you saying that the government of Ontario ought to make as one of its prime goals the eradication of diabetes and fund accordingly?
I think that we should have a plan for controlling and reducing diabetes. Can we get to zero? I think that's going to be difficult, but we need to have a plan. We should not accept that diabetes is going to increase.
But is that something any single province can commit to doing?
I think that we need to have a diabetes strategy clearly that has on its cornerstone, the beginning of the discussion, how can we reduce obesity? How can we prevent diabetes? No question. Yeah.
And a province can do that?
Yeah, I think so. I think we're already starting to see that bend. We're already starting to see the bend for obesity. Where the obesity rates around the world are dramatically varied. We're not, we're a good second class, second province. When you think about who's leading jurisdictions for food policy, what comes to mind? And you're asking the question, I'm answering it, but so I'll answer that, right? Like New York,
okay,
Denmark, Mexico. Mexico brings in, just studies for raising the price, for sugar tax. If Mexico can do that, why can't we?
Well, you heard the reason why. They think it's a tax on poor people.
Well, I'm not the politician and the economist, but when I see that, I say, don't you have levers for every possible taxation? Can't you raise the basic taxation rate? Can't you change taxes in other ways? The science for sugar tax is clear. From what I understand, the polling is above 50% support for it. And so again, I see where Ontario and Canada is sort of middling along. UK brings in sugar tax, and we'll follow after all the leading jurisdictions in prevention will enact things, and we'll learn from them.
But in the meantime, more kids will get diabetes.
Yeah, we are very good in smoking. And now, can we leverage what we learned from how to bring in a really successful smoking program in these other areas?
I know you're a nonpartisan guy, but having said that, you did hear the discussion. You do know what the parties have on offer. It would be reasonable, I think, for me to ask, who's got the best plan?
Who's got the best plan? I'm not sure, honestly. I had, even when you were talking, I had a little bit of a hard time digesting their clear plans. I think everyone is mostly concerned about hospitals, and I think that, again, we need to address that. I think that I would like to see a stronger plan for other parts of the healthcare system. I think attention to mental health was very good as well.
Everybody seems to me anyway, the four major parties have all finally come to a point in their collective histories where mental health is a thing, and they're prepared to actually spend some serious money tackling it. Do you get that sense as well?
I get that sense. I think that we're starting to turn the corner in Ontario and Canada on mental health. I'm hoping. I think there's a lot of encouraging signs, yeah.
What did you not hear today from any of them that you thought, you know, if you were a reasonable person with a well thought through platform, this would have been in the platform, but you didn't see any evidence of it?
Well, I'm going back to the prevention. You know, in our report, we mostly talked about the reduction in healthcare costs from improving health behaviors. You know, and then after we published it, it was people said to me, you know, that report all read about smoking. And it was the 10-year strategy that Sheila Brazer brought in, and it was the 10th year anniversary.
This is the former medical officer of health.
Former medical officer of health from the province that, you know, she was so popular for SARS, and she actually brought in a nice tobacco strategy. And over that 10 years, we calculated there was $10 billion in healthcare savings. The province is investing $50 million a year. So everyone's kind of like, we didn't want to go so far to do all the health economics, but we just laid those numbers down there and goes like, that's pretty good return on investment. You know, $50 million a year, you know, for saving $400 million a year. So I think there's a really strong argument for prevention, and why people aren't picking that up still, you know, it's hard to understand. You know,
you're making the case for it here. May help move that along.
Yeah.
We shall see.
Yeah.
You know what? We're really grateful. You flew in from Ottawa for this, didn't you?
Ottawa,
No, we're grateful. Thanks for doing that. That's Dr. Doug Manuel. He's a senior scientist at the Ottawa Hospital Research Institute, professor in the Department of Family Medicine at the University of Ottawa, and we're happy to have had him in that chair. Thanks, Doug.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.